This is a Theracane that I'm going to use to work on putting some pressure on some tender points in the back of my neck or shoulder. You could use a regular cane. This hook is definitely very handy and then I can reach multiple spots. As I'm doing this, I'm not looking to really put a lot of pressure to where I'm really in a lot of pain or really tender. A little bit of discomfort, 0 to 10 on that pain scale, you're looking for somewhere in like the 2 to 4 range, nothing higher. So I can use this to find, right, many spots back here that I can put pressure on. And some common ones are areas through my upper trap on the top of my shoulder. Others are through levator, which comes down a little closer to the corner of my shoulder blade. So the idea is that if you are turning your head or moving your neck and you feel like there's a spot back there that's sore, if you take a tool like this, or you can also use a tennis ball between you and the wall, and you find that pressure point, you're going to apply light pressure, and you're going to keep that sustained pressure as you just do very light mid-range movements of the neck. So I don't want to take my neck to this extreme of a stretch. I want to just move the tissue that I'm pressing on through a little bit of range without pushing so hard that I'm provoking it or irritating it by overly stretching it. So I could do just a couple little nods of my head. I may also try and do a little bit of looking up. Now, if any of these motions are really uncomfortable, I'm not going to do them. I may also try a little bit of side to side. And like I said, I would vary these different motions for about 30 to 60 seconds, and then I would look for another spot, right? So I could go down the corner of my shoulder blade, down that medial border, and I will also probably find some spots down there. So any of these areas are fair game. And as soon as I find one that feels a little bit more sensitive or a little bit more tender than others, I'll stay there, keep that sustained pressure very light, and I'll go through some of these small neck motions, starting with a little nod, maybe mixing in a little bit of looking up as well, and some side to side. I emphasize they're all mid-range, not going to a stretch or an extreme, but just moving the tissue without a lot of tension on it, because really my goal with this is just to decrease muscle tone. I'm not really trying to break up anything. That muscle is tight and guarded because it's irritated from something that I've done that's put too much pressure on it. Sleeping in an awkward position, sitting at a desk for an extended period of time, rather than putting a lot of pressure on it like it's already had, which has probably irritated it, this sustained pinpointed pressure where I just move it without necessarily overstretching it. And all these areas are very useful to help relieve some neck pain. Afterwards, make sure you check and see that motion that was bothering you, see if it feels better.